ADHD treatment begins with diagnosis confirmation and the education that follows. At this step, the person will react in two ways. They are relieved to finally understand, but they also face anger and regret to not have known before what they had.
If I had known before, I don't know where I would be today, but I would probably have a higher education.
When I learned that I had this trouble, it really affected me. First of all, there was the negative aspect. How many years did I lose? If I had known before, what would it be like? A better education, a better job. All of this happened really, really, really fast. And then there was anger, sadness, frustration. I was angry. I had to go through all this to finally say, okay, this is how I am. I was born this way. I'll die this way. And then what? I can't stay like this. There must be tricks, things of that nature. I talk to people like me, and then you know you're not alone. So the positive aspect arrived.
There are many treatment options. To choose one, the clinician and the person suffering from ADHD look over all the aspects of life that are affected. It's important to identify persistent handicaps despite adaptation strategies in place, but also the person's forces and interests. The doctor has to consider associated problems before suggesting options. All treatments aim at enhancing quality of life by targeting where ADHD-related deficits are not compensated. When symptoms remain a handicap, even after trying adaptation techniques, medication can be useful. Psychotherapy can also be helpful in certain cases, particularly for associated problems like anxiety or depression. Studies show that medication significantly improves symptoms control in about 50 to 70% of people suffering from ADHD.
Treatment helps a lot, but it doesn't do it all. It's really helpful. The efforts I did before didn't give much or any results, depending on the situation. Now it's really useful. Therefore, I want to continue, to go further.
It was like a light. Details I've never seen before. I now saw them. I'm a professional musician. English music lyrics I listened to, I actually heard them. I didn't before. The text was clear. The instructions were clear. People were talking to me and I understood what they were saying. Instead of telling myself, he's talking, okay, about my shopping yesterday. What did I buy? I probably should be listening to him because he's talking. I only saw his lips moving and I had no idea what the person was saying.
We can compare the use of medication for attention trouble to wearing glasses in short-sightedness. Medication used for attention deficit disorder has the same impact as many biological glasses to help the brain to focus better.
I'm more attentive and I work better. My intelligence works more.
Medication used in attention deficit disorder is the same for children, teenagers, and adults, but sometimes doses can vary. Among these medications, there are two different categories. There are psychostimulants. Some have a short duration of effect, such as Ritalin and Excedrin, and others have special delivery systems that permit an extended duration of effect. Among those, we have in Canada Adderall XR, Bifenthrin, and Concerta. The other category is called non-psychostimulants, and in Canada, there's actually only one in this group, and it's Strattera. The adjustment of ADHD medication is similar to the adjustment of glasses, for example. We start with low strength and we progressively increase the dose. We want the best possible symptom control. We'll be on the lookout for the apparition of side effects. We make sure that the person benefits from the highest efficiency every day, all day long, every day of the year. We can notice that a specific medication is efficient after only a few days when we reach the adequate dose of a stimulant. It may be different when we use a non-stimulant like Strattera. It has a different mechanism of action and can take many days, even many weeks, before we see results. It's important to be patient and to remember that we try to find the right pair of glasses for years to come.
At first, I wasn't interested at all to take medication, but I finally decided to try. When I did, it was surprising. All of a sudden, I was able to do a task and to achieve it without being distracted when the phone is ringing or when I have an idea.
The only medication officially recommended for attention deficit disorder are psychostimulants and Strattera. However, we can sometimes use other medication from other classes, such as antidepressors, that also have the capacity to modulate noradrenaline and dopamine. Normally, we'll use this kind of medication when the person also has a problem with depression or anxiety, which requires this kind of treatment. There are different types of products available for ADHD treatment. They do not have the same mechanism of action and have different duration of effect. Ritalin or dexedrine will act for a few hours per dose, while others may work throughout the day, such as Adderall XR, Bifenthrin, Concerta, and Strattera. Side effects profiles will vary from one product to another, but also from one person to another. What's important is to find the best treatment for each individual. What works better, what is well tolerated, what are the best glasses for that person.
The most unpleasant thing was to remember to take each dose. At lunch, I often forgot it. Then it didn't go well in the afternoon.
I had to take it 3 times a day. And when I took it, I was doing great. And later on, I wasn't. I was moody, a little aggressive. I couldn't concentrate. I was like before again. I had to wait before taking the other dose, and I had to wait until it had its effect. It wasn't easy.
I finally decided to try another one, and I feel less tense. I'm more calm.
Among the tricks I give to my patients to be sure they took their medication or to remember to take it, there's the memo, a beeping system, or a system like Dosette, which is a container with compartments for each dose, used as a reminder. We can also ask the pharmacist to prepare the medication in a system called Dispill. This is a system where medication for each moment of the day is individually packed, and they take it at the appropriate time of the day. Most of the time, medication used to help control attention deficit disorder symptoms are well tolerated. However, there's a possibility that the medication can cause side effects. It's good to know what to do if that happens. Among the side effects reported with the use of ADHD medication, there are negative effects related to the digestive system, like nausea or loss of appetite. Some will report difficulty sleeping, while others will complain of a feeling of fatigue during the day. Other people can experience the same effect as a strong coffee, with nervousness, feverishness, or palpitations. We know that blood pressure can increase in certain cases. These side effects, if they present themselves and are transitional, may not be a serious problem. But if these side effects are persistent or have a negative impact, it's important to talk about it with your doctor so he can adjust your dose or maybe even change the medication. About the adjustment of the medication, what's clear is that there is a transition period where we're looking for the right dose. We try to have the best possible balance between symptom control and side effects. It's important not to try adjusting your medication by yourself, but to talk to your doctor about it so he can do the appropriate clinical adjustments.
It was physical, like nausea and loss of appetite. But I was more concentrated, and I had to be careful about what I was eating, like chocolate, because it gave me palpitations.
Many people ask themselves, is there something I can change in my diet, or are there natural products I could take to help me with my attention deficit disorder? The response is that for now, there is no diet or natural products that are proven efficient as a treatment for attention deficit disorder symptoms. Products like omega-3 are currently being studied, but results are not available yet. Particular strategies like biofeedback and neurofeedback techniques are also being studied, but we don't have results to say if they are an efficient treatment or not. There are many psychostimulants we can buy without a prescription. For example, nicotine in tobacco, caffeine in coffee, or certain soda pops. We have to remember that people suffering from attention deficit disorder smoke 3 times more than people in general. They probably consume more coffee, more energy drinks, and stuff like that. It's certainly not a treatment that we recommend.
Often, adults suffering from attention deficit disorder have developed tricks and use them to better control their environment and to answer to difficulties they can have in their lives. Now, even with this and the positive effect of medication, these adults can benefit from other tricks we can give them. Tricks we give to people suffering from attention deficit disorder will cover 5 major aspects: time organization, space organization, budget organization, emotional organization, and internal restlessness control.
When I went back to school about 5 years ago, I had to write a lot. I was writing all the time. All the things I studied, I would write them. When I was at my exam the next day, I closed my eyes, and because I'm visual, I saw what I wrote. That helped me.
It's about combination. I have to make efforts. I have an agenda, and I bring it with me 24 hours a day. I establish tricks to be on time, for example. I have to learn to walk again. My brain is rehabilitating itself. Because of my efforts, I'm not late anymore at school in the morning. I have tricks. When I have to do something, I do it now.
I have an agenda at work. When I have a meeting, I write it in my agenda and in a file. I take my client's file and I put it on a vividly colored paper. I also have very vivid color files. I know these will catch my attention. That's what works for me.
I was so tired. I was totally burned out when I came home from school, and it was so hard intellectually that I almost went to bed right after school.
It's possible to have a better quality of life. You just have to give yourself the chance. It's a matter of choice, of attitude. You have to go further, looking for positive people.
I learned to know myself better and to choose what was right for me.
It's extraordinary to see how we can receive information today with all the media there is, like electronic media, for example. But there's another side to all this. We can receive disinformation or misinformation. Therefore, it's important to ask yourself some questions when you see something about a new treatment, to look for scientific facts. For example, is it safe? Does this one do something more than the other ones? Has it been compared to something we know to be efficient? The benefit to try one of these treatments? I think that if we look at the information in a critical way, that's a win-win situation.
In addition to knowing what ADHD is, to developing adaptive tricks, and to making a better choice among the different medications available, the person suffering from it often needs help to work it out, particularly when ADHD is accompanied by other problems that also require intervention. The person suffering from ADHD could need to consult a learning specialist for learning difficulties, a special education teacher to develop adaptive tricks for themselves or their child, child, a social worker for social or family problems, a counselor to make good education or career choices, a financial advisor to help manage their finances or reduce their debts, or a psychologist to work on personal growth with the help of specific psychotherapy. Certain resources provide nurses and occupational therapists for education, evaluation, and follow-up interventions. Unfortunately, access to specialized resources for adults with ADHD is not available everywhere.
Americans have developed an organizational coaching system. It can be compared to parents who supervise their child or a secretary who helps organize a company head. People who are professional coaches may provide support and help manage people with ADHD. Now we have to be careful because people acting as coaches will often be close to the person with attention deficit disorder. In this case, there has to be a distinction between the role as a coach and the role as the spouse, for example. We have to specify the roles of the spouse so that the person with ADHD really knows when the other person is acting as a coach and when the person is acting as the spouse. This can avoid certain conflicts.
ADHD affects a lot of people and has a major daily impact. It's important to detect it appropriately and to be able to offer efficient treatment options while reducing myths and prejudices around it.
It's not because someone is in university, even in superior education, such as a doctorate, that they can't have difficulties related to ADHD. Even at this level, a person can have attention deficit disorder that can have a major impact every day.
In order to make it easier between us and to make it easier to face society, there has to be less judgment and more comprehension. It's important to realize that we're not like this on purpose. I don't mean to be like this, to be agitated or to talk too much. I don't mean to do it. It's just like that. You can tell us. We have our efforts to make.
People are rejecting the idea of using medication. No, 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 I don't want to take drugs and stuff like that.
We accepted the responsibility to give our child the best quality of life possible, even if that means that he has to take a pill. I think we have to do it. It'll make the difference for your child between a day in hell at school and an almost normal life. It'll make the difference between having 18 warnings during the day compared to maybe 2 or 3.
We have something that's not working well, and the medication helps us to adjust things. It helps us to concentrate and feel better. We're less disturbing for people around us and safer for ourselves.
I want to tell parents and people who will see this to get information, to not judge, because in some ways, we don't live well with this. In the beginning, we're always reprimanded to do things, and people are looking at you and say, "Why is she doing that?" And you don't even know yourself. I often have work meetings, and before I had the medication, while the person in front of me was talking, I was thinking about my laundry.
Because of treatment, everybody has a better quality of life, me included. I often had to manage conflicts between my son, his child, and my husband, who were impulsive and not patient with the child. I was the only one able to control this child because I had the patience for it, and I wasn't impulsive. Now everybody understands better what's going on.
I'd say that with the advancement of research in adult attention deficit disorder during the past 10 years, my wish is that for the 10 years to come, we understand better what's not working at the cognitive level for people with attention deficit disorder. Also, that we develop non-pharmacological strategies to work with medication to better help people with attention deficit disorder who remain with certain symptoms.
We're in a very exciting time period for attention deficit disorder. With the evolution of science, we know more about it and its underlying mechanisms. We know that attention deficit disorder is a neurobiological problem. We know that there's a big genetic part in the transmission. We know more about how the symptoms impact people in daily life, and therefore, we're able to apply appropriate treatments that are more and more efficient. People can better realize their potential when they know that they have attention deficit disorder and find the right treatment. People are better organized to learn what they are afflicted with. There are support groups and help groups, and less taboos. There are more options for people with ADHD, and it's just a beginning.